Tell me a couple of statistical figure or stories or policy measures that give you a lot of confidence that in the past 5 years, things have moved forward or not, like whatever.
Yeah, I think healthcare, what's been interesting, I think there's been two major things. One is that there have been interventions to build every level of the health system, whether it is public health, and I'll come to a couple of specific examples, but whether it's public health, whether it's primary health care, you have the 1.5 lakh health and wellness centers that have been announced, whether it's secondary and tertiary care, which is the Pradhan Mantri Jan Arogya Yojana, or the health insurance scheme, which is being talked about a lot, whether it's human resources for health, right? So new medical colleges are being invested in. Niti Aayog, in fact, led the drafting of the National Medical Commission bill, which is, of course, it's currently pending in Parliament, but the Medical Council of India, which has really been a very problematic body for the longest time, has just recently been replaced by a very competent and meritorious board of governors. To really sort of run medical education much better in the country, whether it's medical devices or drugs, right? Through the Jan Aushadhi stores, drugs have become much more affordable. Cardiac stents, knee implants have become much more affordable. So if you look at the whole picture, there has been, I would say, a very systematic attempt to, intervene at every level of the health system rather than on a piecemeal basis, which is something that might have happened historically. The other is that health has actually come right at the center of policy and political discourse. It's not often that I've walked away from a budget speech of the finance minister like it happened last year, and my biggest takeaway has been health. Ayushman Bharat was the biggest discussion point, and in fact, it remains the biggest discussion point. Whether you criticize it, whether you support it, at least we're talking about health much more. And I think that's crucial because health has to be a policy priority, a political priority, and a public priority. It cannot be something that, okay, when we fall sick, we care about health, but most of the times we're not bothered discussing about it. So I think that's been a huge and a very encouraging shift that I've seen. Somebody who's been in the sector for years and has often struggled to get health, into the center stage. I find that that's become very different now. In terms of a couple of examples, more specifically, as you said, I think if I think about the Mission Indradhanush program, which is the immunization program, we've seen spectacular success there, and in fact, I think as far as public health programs go after polio, this is probably one of the most successful, and in fact, it's received a lot of global acclaim as well recently. So if I just give a comparison point, between 2009 to 2013, we were increasing immunization coverage by about 1% per year. In 2 years of Mission Indradhanush, we managed to raise it to about 6.7% in some of our poorest districts. We've immunized about, I think, 2.5 crore children, about 70 lakh pregnant women just in those first 2 years. So I think what you were even talking about, the pilotitis, right? I think we've seen a lot of scale being achieved in such programs. And I think that gives a lot of hope for the future. Swachh Bharat is, I think, another one where the sanitation coverage has really ramped up. From about 30% in 2014 to now we're at over 90%. Of course, sustaining that and bringing about the behavior change is going to be the challenge in the future, because building toilets is just one part of it. But I think at least we've got to that, step one, which itself we were going at a very slow rate previously. So I think there's a lot of positives that have come out in the last 5 years, but I think health is a very complex sector. We can never say that the job is done or even close to being done. We have a lot more to do in the future if we are to truly achieve universal health coverage, which is sort of the bigger overarching goal. But we've certainly been set on the right path, and I think there's a lot of hope coming out of that.